there's a problem and you can fix it, you should fix it. It doesn't matter whose job it is. It doesn't matter whose technical responsibility it is. These are people. They deserve to be well. They deserve to be looked after. And I think if there's any feasible way to do that, we should be doing it.
There's mutual benefit to this outreach that we do. There's benefit to the community when we can subsidize or provide care at low cost or no cost to people who can't otherwise afford it, where they benefit from our services. There's also reciprocal benefit where the students benefit from seeing not only a diverse patient population, but in diverse environments with diverse resources, differing states of health.
I think Bastyr's active involvement in trying to give care to underserved populations is really, really valuable. I think that naturopathic medicine is really elegant and really beautiful and often much less expensive than some other alternatives.
It's really about getting people to recognize that in themselves they have this capacity to be well. We have to recognize it, unlock it, remove the obstacles to it flourishing. Getting patients to participate in their care is the goal, to be invested not only in understanding what's wrong with them, but also in feeling like they have the tools and encouragement to make the changes that we think are ultimately going to lead to better health.
The knee pain was really preventing me from being as active as I felt like I needed to be. By going to the Bastyr clinic, the students were learning, I was learning right along with them in terms of how to not only manage my pain, but be able to identify when perhaps there was something structurally wrong versus the other pain that just sort of comes with use and aging.
Working with Charlie was such a pleasure. He felt his option was surgery, or maybe we could do something. We taught him skills that he used, so it wasn't some external thing that we gave him that fixed it. It was him spending time, putting in work, and healing himself, and seeing that his body can do that.
A lot of times people who come to naturopathic medicine, they've seen many doctors, they've seen many specialists, and basically nothing has worked. Because Bastyr has a policy that makes healthcare accessible to these people, they can come here and they have a chance to really learn about what our medicine can offer, whether we can help them, and almost always the answer is that yes, we can help them in profound ways that they are not finding in other parts of the healthcare system.
It's not uncommon to see patients go missing for a couple years, and then we'll see them later and say, "Where have you been? When time flies, how's it going?" And they'll be candid and say, "You know, my insurance changed and I couldn't afford the $35 copay, or I was laid off and I didn't have insurance." We're in the midst of a terrible healthcare crisis, and it's not just people's access to healthcare, but even when they have healthcare, the health of the nation is deteriorating. And it's very clear that the future of healthcare is going to require leadership that is going to address the needs of these disenfranchised, underserved, people whose health is really in peril.
To see how patients can change from feeling very hopeless or feeling despair to recognizing that they have the ability to get better and they can see progress and they have somebody who's walking along that journey with them and can guide them that's why I came here.